A single question at the White House sent shockwaves through the GLP-1 world this week. President Trump promised prices around $150 for drugs like Ozempic and Wegovy, leaving everyone asking whether it was a real policy shift or just talk. Plus, Eli Lilly's new oral GLP-1 delivers powerful phase 3 results. France launches a major crackdown on counterfeit obesity drugs, and Consumer Reports issues a lead warning on popular protein powders. All that and more on this week's edition of the Downsized News.
Hey everyone, welcome back to the Downsized News. It's Monday, October 20th, 2025, and we hope you're having a great Monday. Today we're diving into the latest on GLP-1s. I'm Lorraine Durham, and I've lost over 50 pounds with the GLP-1 drug tirzepatide. This journey has transformed my life in more ways than one, and we are here to help you feel informed, empowered, and supported in every step of your GLP-1 journey. So if you're ready for the latest news from the GLP-1 world with a little splash of motivation, stick around here for updates you may not see anywhere else.
And I'm Christopher Durham. I've lost 100 pounds using GLP-1s, and this is where we share what that's really like. The wins, the hard days, and everything in between. We talk about how these medicines changed our lives, the news that impacts all of us, and the science that's shaping what comes next.
If you're new to our channel, welcome. And if you've been with us for a while, welcome back. Please keep in mind that we are not doctors. This is not medical advice. This information is for entertainment purposes only. We share videos on GLP-1 topics every single day, so make sure to hit that like and subscribe button so you don't miss an episode. We cover everything happening in the world of GLP-1s, from Mounjaro, Zepbound, Wegovy, and Ozempic to the new treatments on the way. We look at the science, the policy, and the real stories behind these medications. Our goal is simple: to help people who are treating the disease of obesity understand what's changing, what's coming, and what really matters.
Before we jump into our first story, I just want to remind everyone we are not a political channel and we intend to keep it that way, but we do cover politics and policy when they intersect with GLP-1 medications, patient access, and affordability. We believe that obesity is a disease, not a moral failing. Those living with it deserve the same access to safe, effective medical treatment as anyone managing any other chronic condition. Our mission is simple: to support any policy from any party that helps make GLP-1 medications more accessible and more affordable for the people who need them. Please remember to be kind in the comments. We welcome respectful discussion and different points of view, but this conversation is about helping patients, not politics. Our goal is to fight the disease of obesity, not each other. So story number one is, of course, a political one with all of that. Every so often, a single question changes everything. That moment came on October 16th, 2025 in the East Room of the White House. During what was intended to be a press event on the administration's America First Medicine Initiative, Max Baer, a pharma reporter from Endpoints News, asked President Donald Trump a question that instantly made global headlines. Baer asked about the cost of GLP-1 medications and how they fit into the president's revived Most Favored Nation, or MFN, drug pricing framework, a negotiation strategy designed to push U.S. prices closer to those paid in other developed nations. It's important to note that MFN is not a law, it's a policy position and a negotiation approach that signals the administration's desired direction on drug pricing. Max Baer said, "Mr. President, are GLP-1 weight loss drugs like Ozempic and Wegovy part of your MFN plan?" President Trump said, "I was referring to Ozempic, or the fat loss drug, the fat shot. That'll be much lower. We're talking about $150. As the president continued, Dr. Mehmet Oz, administrator of the Centers for Medicare and Medicaid Services, the CMS, stepped forward and interrupted to clarify. He confirmed that no new rule or agreement have been made and that any changes would come only through ongoing talks with manufacturers. Dr. Oz said, "What the president means is that we're working toward voluntary and negotiated reductions. CMS is in active discussions with manufacturers, but there are no finalized GLP-1 price agreements at this time. We're committed to improving access and affordability, but this is a negotiation process, not a decree." Just days earlier, Dr. Oz had hinted that federal attention on GLP-1 pricing was imminent, saying at the Aspen Institute, "You'll be hearing more about GLP-1s very soon. There's a lot of activity in that space." The moment reverberated instantly throughout the financial world. Shares of Eli Lilly and Novo Nordisk makers of Zepbound, Mounjaro, Wegovy, and Ozempic dropped between 6 and 8% as investors tried to determine whether the statement reflected policy in motion or an offhand comment. And of course, GLP-1 users everywhere started asking questions. While it's exciting to hear a sitting president mention a $150 price target, it's critical to keep expectations grounded. As of today, October 20th, 2025, this remains an off-the-cuff remark made during an unrelated press conference. There is no official policy, no executive action, and no confirmed manufacturer agreement. Millions of patients continue to pay exorbitant prices for the medications that treat the disease of obesity. Until those prices change, the promise of $150 remains only that, promise. We certainly hope it happens, but for now, it's just words, not yet policy. So, to make it clear, there is currently no price strategy that will change prices to $150. Maybe it's coming, and if it does, we will clearly report on it and be excited by it, and we will go out and get some for ourselves.
It's so funny how just the slightest off-the-cuff comments can send stock prices dropping, can send people into a frenzy. We hope someday the prices come down, but so far, nothing's negotiated.
It would definitely be awesome.
Yeah. In story number 2, Eli Lilly is reinforcing its case for a needle-free future in GLP-1 therapy. The company announced new phase 3 data this week showing that its once-daily oral GLP-1 medication, orforglipron, delivered superior blood sugar control and meaningful weight loss in 2 large-scale clinical trials. The results from the ACHIEVE-2 and ACHIEVE-5 studies confirm what Lilly executives have called orforglipron's foundational role in treating type 2 diabetes, and they push the company closer to bringing a next-generation GLP-1 pill to market. In ACHIEVE-2, orforglipron was compared head-to-head with AstraZeneca's Farxiga in adults with type 2 diabetes inadequately controlled on metformin. After 40 weeks, patients taking orforglipron saw A1C reductions of up to 1.7 percentage points, compared to 0.8% with Farxiga. Even the lowest 3 milligram dose significantly outperformed the comparator. Participants also saw notable weight loss and improvements in cardiovascular risk factors, such as blood pressure and lipid profiles. In ACHIEVE-5, orforglipron was tested alongside titrated insulin, glargine, with or without metformin, and SGLT2 inhibitors. Here, patients experienced an additional 2.1% drop in A1C at the 12 milligram dose compared to 0.8% for placebo. All doses of orforglipron achieved statistical significance under both efficacy and treatment regimen analysis. These results show orforglipron's consistent, powerful impact on blood sugar and weight loss across very different patient populations, said Dr. Jess Emick, Senior Vice President of Product Development for Lilly's Cardiometabolic Health Division. It has now demonstrated superiority over 2 active comparators, dapagliflozin in ACHIEVE-2 and oral semaglutide in ACHIEVE-3, and delivered significant A1C reduction when used with insulin in ACHIEVE-5. Together, these results reinforce its potential to become a new standard of care for people living with type 2 diabetes. Both studies reported safety and tolerability consistent with earlier trials. The most common side effects were gastrointestinal, nausea, diarrhea, and mild stomach discomfort, generally classified as mild to moderate. Importantly, Lilly reported no liver safety signal and treatment discontinuation rates consistent with other GLP-1 agents. The ACHIEVE program represents one of the largest oral GLP-1 research efforts to date, with more than 6,000 participants across 5 global registration trials. The final study in the program, ACHIEVE-4, is expected to read out in early 2026. Lilly plans to submit regulatory applications for type 2 diabetes that same year and is still on track to seek approval for obesity treatment by the end of 2025. Unlike other oral GLP-1s, such as Novo Nordisk's Rybelsus, which are semaglutide tablets, orforglipron is a small molecule, non-peptide drug that can be taken any time of day with or without food or water. a key advantage for patient adherence. It was originally discovered by Chugai Pharmaceutical in Japan and licensed to Lilly in 2018. The company is also studying orforglipron as a potential treatment for obesity, obstructive sleep apnea, hypertension, and osteoarthritis pain in adults with obesity. For patients, this progress could mean greater access and fewer barriers. An oral GLP-1 that delivers strong results without the need for refrigeration, injection, or tight dosing conditions could reshape how both obesity and diabetes are treated. For Lilly, it signals the company's growing dominance in the GLP-1 space and its ambition to make these therapies more convenient for the millions who need them.
So it's coming. The research is looking good.
Everything we've been hearing about, or reading, seeing, reporting about orforglipron all seems like good news. So let's get it in there and get it approved.
Absolutely.
And get it in our hands.
Story number 3, a wave of counterfeit GLP-1 medications flooding the internet has triggered an aggressive crackdown by French health authorities. From sham teleconsultations to influencer-promoted scams, the French National Agency for the Safety of Medicines, or the ANSM, and European regulators are racing to contain what's quickly becoming a global threat to patient safety. The runaway success of obesity and diabetes medications such as Ozempic, Wegovy, and Mounjaro has fueled a shadow market of falsified drugs sold online. In September, the European Medicines Agency and national health agencies issued a joint alert warning that many of these so-called GLP-1 analogs are sold via fraudulent websites promoted on social media and not authorized or tested for safety or efficacy. Investigators uncovered hundreds of fake listings and Facebook profiles, some misusing official pharmaceutical logos to appear legitimate. In France, the problem worsened after new prescribing rules expanded physician access to obesity drugs. Since spring, ANSM has referred around 20 reports involving roughly a dozen merchant websites to Pharos, the Interior Ministry's platform for reporting illegal online content. The counterfeiters' tactics are evolving. Recent seizures included microneedle patches, falsely marketed as GLP-1 therapies, a form never approved for use. ANSM called the products dangerous and deceptive, warning of potential serious health risks. The agency says new sanitary police measures will soon be introduced to ban advertising and block online sales. The French Federation of Diabetics, or the FFD, says this latest surge of fake drugs recalls earlier black market activity that led to shortages. We're extremely worried, says Jean-Francois Thibault, the FFD's vice president. Fraudsters are selling counterfeit products with no quality control, and patients have no way of knowing what's really in them. FFD continues to work with regulators and consumer protection agencies to identify illegal sites, though the process remains reactive. Every time one site is closed, another opens, said Thibault. Novo Nordisk, maker of Ozempic and Wegovy, says it's working closely with authorities through a global anti-counterfeiting strategy built on 3 principles: prevent, detect, and respond. The company urges patients to report suspicious products, providing photos and lot numbers to help investigations. The pharmaceutical giant also supports training and capacity building, initiatives for law enforcement agencies combating drug fraud. France's National Council of Orders of Physicians is also investigating reports of doctors promoting GLP-1 products on social media. A new charter signed with YouTube in early 2025 outlines ethical rules for medical creators, prohibiting any form of advertising disguised as education. CNOM says physicians who violate the guidelines could face disciplinary action or channel removal. The council has also issued zero-tolerance warnings against sham teleconsultations after a national TV report exposed a Paris-based surgeon writing fraudulent GLP-1 prescriptions. Issuing false prescriptions, CNOM emphasized, is a criminal offense punishable by suspension and up to 3 years in prison. Officials stressed that legitimate patients must not be caught in the backlash. We must be vigilant without creating witch hunts, said CNOM. These medications have a rightful medical purpose, but they must be prescribed safely and obtained through legal channels. As the demand for GLP-1 drugs continues to rise worldwide, France's actions offer a warning for every market. When access, affordability, and trust falter, counterfeiters move in. So this is just stuff people selling fake stuff. It's like a fake purse.
Scary. You're injecting fake medicine into your body from who knows where. It's dangerous. In story number 4, there's significant news this week in diabetes care, and it comes in pill form. The U.S. Food and Drug Administration has approved Novo Nordisk's Rybelsus, the only oral version of semaglutide to reduce the risk of major cardiovascular events in adults with type 2 diabetes who are at high risk for heart attack, stroke, or cardiovascular death. What makes this so notable is that the approval applies to both people who have already had a heart event and those who have not. In other words, it's approved for both primary and secondary prevention, an expansion that makes Rybelsus the first and only oral GLP therapy proven to protect the heart. The decision is based on results from the SOUL trial, a large international study that followed nearly 9,700 adults with type 2 diabetes considered at high cardiovascular risk. Participants received either 14 milligrams of oral semaglutide or a placebo, alongside standard care, and were followed for an average of 4 years. By the end of the trial, major cardiovascular events, things like heart attack, stroke, or cardiovascular death, occurred in about 12% of the people taking semaglutide, compared with nearly 14% of those taking a placebo. That 14% relative risk reduction was statistically significant, and it showed that oral semaglutide not only controls blood sugar, but also offers measurable protection for the heart. Dr. John Buse, who led the study from the University of North Carolina, said the results show how semaglutide can address multiple aspects of diabetes. He called the findings a major advancement that showcases the versatility of semaglutide and the importance of therapies that go beyond glucose control. The safety profile of oral semaglutide was consistent with previous trials, with fewer overall serious adverse events compared to placebo, though gastrointestinal issues remain the most common side effect. Novo Nordisk executives described the approval as a milestone that sets a new benchmark for oral treatments. Dave Moore, the company's executive vice president of U.S. operations, said, "The semaglutide molecule has consistently demonstrated robust outcomes across multiple large-scale trials, further reinforcing its established cardiovascular profile." Rybelsus was first approved by the FDA in 2019 as the world's first GLP-1 pill designed to help control blood sugar in adults with type 2 diabetes alongside diet and exercise. More than 2.4 million people worldwide have been prescribed it. Now, with its heart protective indication, the drug's reach may grow even further, particularly among people who prefer a daily pill over an injection. Novo Nordisk has also submitted an FDA application for an oral version of Wegovy, its semaglutide-based obesity treatment, with a decision expected later this year. For people living with diabetes, this approval offers something new, a once-daily pill that can help protect not just blood sugar, but the heart as well.
So, just does more stuff. Rybelsus is really killing it. I think it's interesting they're doing placebos on type 2 diabetics with heart problems, though.
Yeah.
You can't give them another medication?
People died. It's like...
Yeah, I don't know. That just seems wrong.
It's a little
to me.
disturbing. Yeah. Well, I mean, I guess you have to have a control group, and maybe not everybody wants to be on a medication.
I mean, a lot of times they'll compare
choice.
To an existing treatment, though, not just to no treatment.
Well, and it was 14% versus 12%, so it's really only slightly better, but still considered statistically significant. I mean, if I had a cardiovascular problem, I'd want all the help I could get, for sure.
Well, then the only significant statistic is one, you.
Right.
It's the only one you can
I am
remember.
an expert in a sample of one, myself.
Story number 5, chemistry and endocrinology researchers from Syracuse University and the Seattle Children's Research Institute have developed a new experimental treatment for diabetes and obesity that activates 2 major metabolic pathways at once. The compound, called KCEM1, targets both the melanocortin-4 receptor, the MC4R, and the glucagon-like peptide-1 receptor, the GLP-1R, offering a potential new class of medications that could rival today's GLP-1 drugs such as semaglutide and tirzepatide. In a study published in the journal Metabolism in October 2025, the team reported that KCEM1 achieved similar weight loss to semaglutide and tirzepatide in diet-induced obese rats, while producing even better blood sugar control. The results also showed reduced inflammation and improved liver health, suggesting benefits beyond weight management. GLP-1 based drugs like Zepbound, Mounjaro, and Wegovy have changed how doctors treat obesity, but many patients struggle with side effects such as nausea and vomiting. Nearly 30% of patients stop treatment within 3 months, and almost half quit within a year, according to the FDA adverse event data cited in the new study. Lead author Dr. Robert P. Doyle of Syracuse University said KCEM1 was designed to maintain the weight loss effects of GLP-1 medications while improving tolerability and glucose regulation. KCEM1 is a synthetic peptide that infuses elements of exendin-4, the foundation of many GLP-1 medications, with alpha-melanocyte-stimulating hormone, which activates the body's melanocortin system. In a 7-week study of obese rats, animals treated with KCEM1 lost about 14% of their body weight, comparable to semaglutide and tirzepatide. Their food intake dropped by 26.5%, and glucose tolerance testing showed superior blood sugar control. KCEM1 also reduced liver cholesterol and triglyceride levels, improved metabolic-associated steatohepatitis, or MASH, scores and lower markers of inflammation such as IL-6 and TNF-A. The compound appears to work by activating multiple receptors involved in energy balance, hunger, and glucose metabolism. While the GLP-1 receptor reduces appetite and slows digestion, MC4R and MC5R activation influence both central and peripheral mechanisms, helping regulate food intake, increase skeletal muscle glucose uptake, and enhance insulin sensitivity. This polypharmacy approach allows KCEM1 to deliver combined benefits, even though it is a weaker GLP-1 agonist than current drugs. Researchers emphasize that KCEM1 is still in early development and not ready for human testing. The peptide's short half-life and potential for melanocortin-related side effects, such as skin pigmentation, will need to be addressed before clinical trials. Still, the study's senior authors, Dr. Doyle and Dr. Christian Roth of Seattle Children's, have filed a patent and say they believe the discovery could shape the next generation of obesity therapies. KCEM1's success in preclinical trials supports a growing shift towards multi-target metabolic drugs, combining appetite, hormonal, and energy-regulating pathways for greater efficacy and fewer side effects. If these findings translate to humans, KCEM1 could represent a new frontier in obesity care, a treatment that delivers GLP-1 level weight loss with stronger glucose control and improved overall metabolic health. So that's a new side effect I haven't heard. Spots on your skin, basically.
That would be disturbing.
Yeah.
I mean, there's just so many new medications in development. We're just going to have a lot of them in the coming years.
Who knows whether they'll make it to market or not.
In story number 6, once synonymous with calorie counting and in-person meetings, Weight Watchers is now fighting to stay relevant in the age of GLP-1 medications. After decades as a dominant name in weight loss, the company filed for Chapter 11 bankruptcy in May 2025, crippled by a collapsing membership base and the explosive rise of medications such as Zepbound, Mounjaro, Wegovy, and Ozempic. Now emerging from bankruptcy with a new leadership team, Weight Watchers is betting its future on telehealth, digital care, and obesity medications. Its latest effort, a new employer program called Weight Watchers RX Flex Fund, aims to make GLP-1s more affordable by offering direct manufacturer pricing and flexible employer subsidies covering 25% to 75% of the drug costs. The medications would be prescribed through Weight Watchers Clinic, the rebranded telehealth platform formerly known as Sequence, which Weight Watchers acquired in 2023 as part of its pivot toward clinical obesity treatment. We're trying to give employers a way to support their teams without the chaos of traditional insurance models, said Scott Honkin, pharmacist, and also the company's chief commercial officer. Rising GLP-1 costs have left employers looking for innovation, not more red tape. But Weight Watchers' turnaround is far from guaranteed. The Employee Benefit Research Institute, or EBRI, warns that employer coverage of GLP-1s could raise premiums by 5 to 14%, depending on drug costs and patient adherence. Even at lower prices, around $200 a month, insurers would still see increases of 1 to 4%. The company's new chief medical officer, Dr. Kim Boyd, argues the model could actually save money long term. She points to research showing that when individuals with chronic conditions lose weight, annual healthcare expenses fall by about 20%, with the biggest savings among patients with higher BMIs. Still, Weight Watchers faces an uphill climb. Its once loyal customer base has migrated to newer digital platforms, and its traditional weight loss programs, once marketed as empowering and affordable, now compete with the rapid medication-driven results of GLP-1 users. To regain relevance, the company is betting on partnerships with pharmaceutical makers like Novo Nordisk, launching initiatives such as its July 2025 program offering Wegovy, which is semaglutide, through Weight Watchers Clinic. Whether this new medically integrated model can save the brand remains to be seen. What's clear is that Weight Watchers is no longer just counting points, it's counting on GLP-1s to survive.
Has it tough a choice?
No, this is the only thing they can do to save their business. The people who loved Weight Watchers and have been Weight Watchers supporters are aging out, aging out of the program. And as GLP-1s become more well-known and people know how effective they are, nobody's going to want to count points anymore.
Probably not.
Me included. Any coincidence that when I left, they filed for bankruptcy? Probably
not.
Probably not related.
Probably not. Story number 7, a new study from Virginia Tech is shedding light on another surprising effect of GLP-1 medications, how they may change the way your body processes alcohol. The research published in Scientific Reports and led by Dr. Fatima Kodas and led by Dr. Alexandra De Felicia Antonio from the Fralin Biomedical Research Institute is titled A Preliminary Study of the Physiological and Perceptual Effects of GLP-1 Receptor Agonists During Alcohol Consumption in People with Obesity, or as Lorraine would say, a really long sentence.
Indeed.
However, that's the name of the research. The team studied 20 adults with obesity, 10 who were taking a GLP-1 medication such as semaglutide, liraglutide, or tirzepatide, and 10 who were not. Each participant received a carefully measured dose of alcohol meant to raise their blood alcohol level to about 0.08, the legal driving limit. The results were clear and measurable. People taking GLP-1 medications had a 40 to 50% slower rise in blood alcohol levels in the first 20 minutes after drinking. At the 10-minute mark, their average breath alcohol was 0.021 compared to 0.037 in those not taking GLP-1s. They also reported feeling less intoxicated, rating their How Drunk Do You Feel scores about 25 to 35% lower during the first hour. And there's more. Participants on GLP-1s reported lower cravings for another drink, and unlike the control group, didn't experience the usual increase in appetite that alcohol tends to trigger. Researchers believe this is likely caused by slower gastric emptying. In other words, the medication delays how quickly the stomach empties into the small intestine where alcohol is absorbed. That means alcohol reaches the bloodstream more slowly, reducing its short-term rewarding effects, and possibly lowering the drive to drink. These findings build on earlier research showing that people taking GLP-1s tend to drink less, binge less, and even have lower rates of alcohol use disorder. A 2025 JAMA psychiatry trial found semaglutide reduced alcohol consumption and craving in people with alcohol use disorder, and this new study explains why. It's important to note that this was a small pilot study, only 20 people, but the data is compelling. As the authors say, these findings provide preliminary evidence that GLP-1 receptor agonists could act through peripheral mechanisms to suppress alcohol intake. For those of us using GLP-1s to treat obesity, it's another unexpected bonus, one that might help quiet not just food noise, but the urge for another drink. So I can only imagine there was a flyer on the Virginia Tech campus that said, hey, come have a drink with us and do a medical.
Shots.
And 20 kids showed up and had a shot.
Well, I understand. I can relate to what they're saying. So the alcohol absorbs in your body more slowly on a GLP-1. You don't get a buzz from it. You don't feel drunk from it as quickly. And therefore, maybe you don't want to keep going because you're just like, eh.
So the alcohol is absorbed in your small intestine, not in your stomach. I did not know that.
Yeah, that's what it said. It goes from your stomach to your small intestines where it is absorbed and then it enters your bloodstream. So all that's just happening much slower. But I wonder at what point does a person on GLP-1 catch up to a person not on GLP-1? You know what I mean? Like,
Oh, I'm sure you could.
I eat a donut, not on GLP-1. I eat a donut, my brain lights up and says, give me more donuts. I eat more donuts and more donuts and more donuts till I'm sick. Similar to alcohol, you take a shot of alcohol, I feel good, I want another one. I take another one, I feel great. Take another one.
Yeah, it's going to catch up sooner
If you
or later.
don't have that good feeling from it, you won't keep doing it.
Yeah.
In story number 8, researchers at the University of Utah have discovered a powerful new enzyme that could lead to stronger, longer-lasting versions of GLP-1 medications, the same class of drugs behind Zepbound, Mounjaro, and Wegovy. The enzyme, called PAP-B, can literally tie off peptide-based drugs into tight chemical rings, a process known as macrocyclization. That's important because forming these ring structures can make a drug more stable, help it last longer in the body, and improve how it performs. The study, led by Dr. Karsten Eastman and Dr. Vey Bendarian, was published October 14th in the journal ACS Bio and MedChem AU under the title Leader-Independent C-Terminal Modification by a Radical S-Adenosine L-Methylamine Motardase Enables Macrocyclic GLP-1 Peptides. Did I get that right?
Probably not.
Close enough. We'll put a link in the description. Eastman, who co-founded a biotech startup called Sathera Therapeutics, said this discovery could be a major step forward in peptide drug design. He explained that peptides, the small protein-like molecules used in GLP-1s, are great at doing specific things in the body, but they're fragile. The body's enzymes can break them down within minutes. By using PAP-B to tie off the ends of these peptides, Eastman says researchers can effectively hide them from the enzymes that would normally destroy them, creating longer-lasting, more stable medications. In lab tests, the team used PAP-B to modify 3 GLP-1-like peptides, and in every case, the enzyme successfully converted each one into a ringed version. Even more impressive, it worked without needing a leader sequence, which is normally required for this type of chemistry. That means PAP-B could serve as a plug-and-play tool for scientists to fine-tune existing GLP-1 drugs, adding new chemical rings late in the development process to extend their lifespan and potentially adjust how they signal in the body. Eastman says, quote, Big Pharma's GLP-1 backbones are already excellent. What we're adding is a clean, late-stage enzymatic step that can make these molecules work even harder. By installing a small, well-defined ring, we can tune how long the drug lasts, how stable it is, and even how it signals. The discovery also earned Eastman and Bendarian the University of Utah's 2025 Founders of the Year Award for their work in developing the polymacrocyclic peptide discovery platform, the core technology behind Sathera Therapeutics. It's still early days, but the implications are big. This enzyme could make it easier and cheaper to create future GLP-1 therapies that last longer, stay more stable in the body, and may even perform better than today's medications.
I think it sounds cool.
Scientists doing science.
Yeah.
Sciencey things. Sounds good to me.
Story number 9, as the GLP-1 movement reshapes not just waistlines, but entire industries, Fine Dining Lovers, which is a website run by San Pellegrino, is reporting that restaurants are now stepping up to meet the moment. Cuba Libre, a Cuban restaurant with locations in Philadelphia, Atlantic City, Washington, D.C., and Orlando, is introducing what it calls the GLP Wonderful, get it, Wonderful menu?
Oh,
yeah, GLP Wonderful menu.
Wonderful.
A creative new dining option designed for guests using GLP-1 medications. The 5-course menu is smaller, leaner, and smarter, carb light, fiber-filled, and protein-forward, reflecting how many GLP-1 users are learning to eat, less volume, more nutrition. Each dish still celebrates the vibrant flavors of Cuban cuisine with options like salmon a la plancha, ropa vieja, and pollo asado, presented in portion sizes that fit GLP-1 adjusted appetites. Cuba Libre founder Barry Guten said the concept came to him after multiple regulars mentioned being on GLP-1s and wishing there were more menu options that made sense for their new normal. He collaborated with Chef Angel Roque and Dr. Charlie Seltzer, an obesity medicine special, to build something that felt indulgent yet intentional. You don't dumb down the dishes because they don't have much of an appetite, Guten told fine dining lovers. Instead of giving them boiled chicken, you have to make it super appealing. While other restaurants, including Tucci and Clinton Hall in New York, have quietly added smaller portion options, Cuba Libre is among the first to explicitly label as GLP-1 users' appetites and metabolisms change. Restaurants like Cuba Libre are finding new ways to make dining out both satisfying and sustainable. Whatever your take, one thing is clear. The GLP-1 era has officially reached the dinner table, and the menu just got a lot more interesting.
I appreciate that they're making smaller portions and things that taste super appealing rather than the old boiled chicken and broccoli we used to get in years past.
Well, I think eventually what happens is it changes dining out altogether. So this age of the 70s, 80s, 90s where I needed a bigger portion.
Right. Portions got huge.
And there was 2,000 calories on a plate that nobody ever needed. I think it's going to go away.
Or shrink. The portions are going to shrink to a properly sized portion, which we should have had all along, right?
And then we adjust our expectation and say, I don't need 2 pounds of food. I need the appropriate sized portion that tastes good, is a high quality, and is nutritious at a good price. Period. Crazy, I know.
And story number 10, we grew up in the 80s when Pop-Tarts, Doritos, and the sugary cereals ruled lunch boxes and the late nights alike. These were the snacks that got us through, quick, colorful, and definitely not healthy. Now, decades later, those same brands are trying to meet a very different moment. America's favorite comfort foods are getting a muscle makeover. With the protein market projected to surge past $100 billion by 2030, food giants like Kellanova and PepsiCo are racing to rebrand indulgence as fuel. And it's not just for gym goers anymore. Snack maker Kellanova announced that Pop-Tarts Protein will hit shelves this November in 3 flavors. I'm so excited about this. Slammin' Strawberry, Bumpin' Blueberry, and Boostin' Brown Sugar Cinnamon. My sister will be thrilled. Each pastry will pack 10 grams of protein, roughly double the original. But before anyone calls it a health food, take note. The protein versions appear to have similar calories, around 380 to 400, and nearly 31 grams of sugar. About the same as the classic version, according to early product images. Meanwhile, PepsiCo CEO Raymond LaGuardia told investors the company is going all in on protein innovation. Beyond Doritos with added protein, PepsiCo is relaunching Muscle Milk, expanding its Starbucks bottled protein drinks, and preparing to roll out Propel Clear Protein, a new powder that combines electrolytes, fiber, and 20 grams of protein. The company says a broader protein beverage lineup will arrive in early 2026, reflecting growing demand from athletes, everyday consumers, and even GLP-1 users who are looking for filling snacks that actually satisfy. The protein craze has been building for years, but it's now colliding with the GLP-1 boom, where patients using medications such as Zepbound, Mounjaro, and Wegovy are searching for nutrient-dense, high-protein foods to preserve muscle and stay full longer. Still, these new offerings from Big Food might not fit that prescription. Competing products from Quest Nutrition and Legendary Foods already offer low sugar and higher protein alternatives, like Quest's Nacho Cheese Chips with 18 grams of protein and 150 calories, and Legendary's Protein Pastry with 20 grams of protein, 180 calories, and 9 grams of fiber. LaGuardia also hinted that the next big frontier is fiber, calling it the next protein. He said consumers are beginning to realize fiber's importance and that its absence in the American diet represents another massive opportunity. For those of us once tore open foil Pop-Tarts on the way to school or grabbed Doritos during a late-night movie, it's a little surreal to see those same brands trying to fit into the protein and fiber world of 2025. Big Food isn't just chasing gym rats anymore, it's chasing the GLP-1 generation, where protein and fiber are the new sugar and fat. Whether these reimagined snacks truly deliver better nutrition or just better marketing remains to be seen. Stay tuned, we'll have to do a taste test and see if these new power snacks live up to the hype. Protein Pop-Tarts. I've tried the Legendary protein pastries. Well, they're expensive. I think you can get a box is $9.99 at Target, and I think you get like 3 foil pouches, 3 or 4 pastries in the pack. I wonder if the protein Pop-Tarts
They'll be
more expensive.
Sure.
And if they have the same number of calories and the same amount of sugar, like that's just disappointing. Like you just missed a big opportunity there to make them better.
You don't think they're aiming? I think they're aiming to a mom who goes, well, this is a little better. This is healthy, right? It's kind of that Snackwell mentality.
Yeah.
Yeah. Must be good for you because
be good for you. They're fat free.
Yeah.
I mean, I loved Pop-Tarts as a child. My sister and I grew up on brown sugar cinnamon Pop-Tarts. So,
I mean, to me, it's just kind of missing.
she'll get 'em.
It's kind of missing the point.
you missed the point of making them better all around. Like you could have added fiber to them. You could have lowered the sugar. You could
just create a better product.
Could have created a better product.
That
but
probably
you know
doesn't
what?
need all that sugar.
What is better than the original Pop-Tart?
I do love a brown sugar and cinnamon Pop-Tart.
As do I.
Story number 11, if you're using a GLP-1 medication, protein is a big part of your life. It helps maintain muscle and keeps you fueled when appetite drops. But a new Consumer Reports investigation has revealed that many protein powders could come with a hidden danger, lead. Consumer Reports tested 23 of the most popular protein powders and shakes. More than 2/3 contained more lead in a single serving than their experts say is safe for an entire day. Some were 10 times higher. The worst offender was Naked Nutrition's vegan mass gainer, with nearly twice the lead per serving as the most contaminated product from their last test 15 years ago. Other plant-based powders like Garden of Life and Momentous also tested high for lead, cadmium, and arsenic. For GLP-1 users, that's a concern. Many rely on shakes when food noise is quiet or hunger is low. But unlike medications, protein powders aren't reviewed or approved by the FDA, and there are no federal limits on heavy metal content. Reese Tunde Akinle said it simply, we advise against daily use for most protein powders, and Harvard's Dr. Rose Goldman added that lead builds up in the body and can cause long-term damage over time. Plant-based products tested about 9 times higher in lead than dairy-based ones, though even half the whey products had concerning levels. It's also worth noting that Consumer Reports focused mainly on fitness and bodybuilding brands, not the bariatric or GLP-1 focused products we often see discussed in our community. Consumer Reports is an independent nonprofit organization founded in 1936 to promote truth, transparency, and fairness in the marketplace. For nearly 90 years, they've earned trust through unbiased testing, investigative journalism, and consumer advocacy, with one goal: to protect and empower people. So a couple of people have asked me about Consumer Reports. They're legit. They do real testing. I don't see any ulterior motive here. Consumer Reports recommends, first of all, to limit use, treat protein powders as an occasional supplement, not a daily habit. To check for transparency, look for brands that publish independent third-party test results. A few do. And favor real food. Get protein from eggs, dairy, beans, tofu, fish, or chicken instead of powders. And be cautious if pregnant or feeding children. Lead exposure is especially harmful during development. Transparency and safety matter in our medications, our care, and our nutrition. This Consumer Reports investigation is a reminder to stay informed and make choices that protect your health. So it's concerning. I mean, pay attention. If all you're doing is getting your protein from powders, eat real food, please.
Well, I mean, definitely avoid that top one on their list. But beyond that, how does one know if their favorite protein powder has a lead concentration in it?
Well, that's why they're saying you need to look for one that has testing on it.
I've never seen one.
Have we ever looked?
I mean, I read the label. In story number 12, the U.S. Food and Drug Administration has issued its harshest possible classification, official action indicated, to Novo Nordisk's Indiana manufacturing plant, calling the site in an unacceptable state of compliance. The plant, which Novo acquired in 2024 as part of its $16.5 billion purchase of Catalent, plays a key role in the company's drug production network, including operations that support its GLP-1 supply chain. According to the FDA's inspection report, the facility was cited for serious contamination issues, including cat hair. Where did cat hair come from? In a factory that makes medications, bacteria, and pests, as well as repeated failures to identify root causes or evaluate the impact on finished products. Some complaints of foreign matter in manufactured vials date back to mid-2022. The inspection findings raise new concern for Novo Nordisk as it continues struggling to meet surging global demand for its GLP-1 medications, including Ozempic, Wegovy, and Rybelsus, all of which rely on a tightly stretched production network. Any delays or disruptions at U.S. facilities could further strain availability for patients already facing long waits and limited access. Novo has said it is working to address the issues, but the FDA's designation means corrective actions will be required before the plant can return to full regulatory compliance. The facility handles fill-finish operations, the process of filling vials and syringes with medication, a critical step in producing GLP-1s and other injectable drugs. For now, the unacceptable ruling adds another layer of uncertainty to Novo's manufacturing capacity, which remains central to its ability to supply the GLP-1 medications that millions of patients depend on.
So to me,
why are there cats in it?
I don't know whether there's cats there, and I don't know how a Novo executive can file all these reports, all these lawsuits, and say how unsafe compounding is
when
they've apparently got cats in their factory.
Jojo, have you been over at Novo's plant? What the heck?
You know what? Regardless of who's making these medications, whether it be a compounder, Novo, Lilly, Viking, it doesn't matter. Make them correctly, follow the rules, have a clean factory. I don't understand the problem here.
I guess when you make, billions of dollars per quarter, you should be able to run a
and get off your
factory.
high horse, Novo. Honestly, I don't get it. It's crazy. That wraps up this edition of the Downsized News.
If you're looking for tools and ideas to help on your GLP-1 adventure, visit our website at thedownsized.org. You'll find links there to our Downsized GLP-1 Amazon store, our separate Downsized email list, our 2026 Downsized cruise, and other great stuff you should check out. We are Amazon affiliates, so when you shop through our store, you're helping support our channel, and it doesn't cost you anything extra. So make sure you subscribe to The Downsized so you don't miss out.
If you haven't yet, hit like, subscribe to The Downsized, and turn on the notification bell so you don't miss our next video. We'll keep you posted on the latest GLP-1 news, explain the science in plain English, and share what's really happening in our own adventure. Join us and come be a part of the Downsized community. We are battling the disease of obesity together. Obesity is a disease. It's not your fault. We'll see you next time.
I'm Lorraine Durham.
And I'm Christopher Durham. We are the Downsized.